Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Bera, that stands for the Brain Evoked Response Audiometry, aka the ABR. ABR stands for the Auditory Brainstem Response. So what is this? This is an objective test that records the electrical activity. So it is an objective test. And what does it do? It records the electrical activity. So if you look at the electrical activity, it is recorded, and the electrical activity, what occurs in the auditory pathway. So this thing occurs in the auditory pathway. Now there are 7 waves produced in the first 10 milliseconds. So there's wave 1, then comes wave 2, next is wave 3, then there is a 4th wave, then comes the wave 5. So this will peak. So the wave 5, this is wave 5. So what we see is the wave 4 peaks and also the wave 5, there is increase in peaks. So let's break it down. So what is the 1 associated with? So there is the wave 1. So wave 1, it is distal part of the cochlear nerve. So it is the distal part of the cochlear nerve. So this is not cranial nerve, this is the cochlear nerve. So what is wave 2? The wave 2, if you see, it is the proximal part. So this is the proximal part of the cochlear nerve. Then moving on to the third type. So wave 3 is nothing but the cochlear nerve. Next is the wave 4. The wave 4 is a superior olivary complex. So it is a superior olivary complex. So this is wave 4, where there is a peak. Next, there is a bigger peak at wave 5. So this wave 5, it stands for the lateral lemniscus. So it is lateral lemniscus. Wave 3 was cochlear, wave 4 is superior olivary complex. And then wave 1 and 2 are distal and proximal cochlear nerves. So this is the lateral lemniscus. Next is we look at the wave 5 and 6 and 7. So there is wave 6 and 7. So this wave 6 and 7, it stands for the inferior colliculus. So this is nothing but the inferior colliculus. Now let's move on to the findings. So what will be the findings here? The finding is in terms of the conductive or the cochlear pathology, in terms of the conductive or the cochlear pathology. So in the conductive or the cochlear pathology, there is delayed wave I1. So there will be a delayed in the wave 1. So there is delay in wave 1, but the interpeak latency of 1 and 5 is normal. But the interpeak latency of 1 to 5 is normal. Next is the retrocochlear pathology. So under the retrocochlear pathology, the wave 1 is present and the rest of the wave is absent. So only 1 is present in the retrocochlear pathology, others are absent. In conductive pathology, the delayed wave 1, but interpeak latency of 1 to 5 is normal. Next we'll move on to the acoustic neuroma. So what is acoustic neuroma? So here in acoustic neuroma are the vestibular schwannoma. So it is known as acoustic neuroma or the vestibular schwannoma. So it is increased interpeak latency. In first one, the interpeak latency was normal. Here it is there is increase in the interpeak latency. So this increase in interpeak latency, and this is of the wave 1 to 5. So this is a wave 1 to 5, and there is an increase in the intraoral latency. So there is increase in the intraoral latency. So there is increase in the intraoral latency of the wave. So this is wave 5 greater than 0.2 ms, that is a millisecond. Now let's look at the uses. So what are the uses of this? So let's look at uses. So in uses, the objectively finding the hearing threshold. So you find the the hearing threshold. So you find the hearing threshold, and here what you do is there is a wave phi appears 10 dB. So there is the wave phi. So the wave phi, it appears as 10 dB and above the hearing level obtained through the PTA. So this is above the hearing level. So it is above the hearing level and it is obtained through the PTA. Next is the best audiometric test. So there is an audiometric test. So what happens here in the audiometric test? So it is used to confirm the hearing loss in infants. So you look at the HL, that is the hearing loss in terms of the infants. Next is diagnosing of the acoustic neuroma diagnosis. Then comes differentiating the cochlear. So you differentiate cochlear versus that of the RC, that is a retrocochlear hearing loss. Then you diagnose the non-organic hearing loss. So you diagnose the non-organic HL, that is a hearing loss. To learn and grow daily like this, please do subscribe.